The way to think about cervical cancer prevention with regards to disparities is really about access to care, because we actually know a ton about what causes the development of cervical cancer, and what we know is that people will die if they are not adequately screened. And really the differences that we see for African American women, for Latino women, for American Indian women really has to do with differences in accesses rather than differences in biology. Primary prevention with HPV vaccination is a hugely important tool that has come into our hands in, just the last 6-7 years, and which we need to figure out how to use even more effectively. That is, how to increase coverage. This is one of the success stories in terms of where minority populations and poor populations are actually doing better than the rest of the population. If you look at coverage rates for vaccination among Latinas, among American Indians, among people below the federal poverty level, it's actually higher than would be expected for the rest of the population. So this is a success story we need to continue to amplify. People who are challenged in terms of having insurance coverage have to sort of take hold of a lot of different resources. One extremely important resource for people who are underscreened in this state is the Well Women's Health Check program. The Well Women's Health Check program specifically targets women who are under or unscreened in this community and in this state. And for us, that ends up being women from populations of color, poor women, and women who don't otherwise have access to insurance.